Burning pain, shooting pain, zapping, numbing, tingling, pins and needles, all of these are symptoms of what we call neuralgias. And today we're talking about these neuralgias all over your body and what might the causes be of those things. My name is Chris, I'm the Director of the Headache and Pain Management Centre. Type in below if you're experiencing these symptoms because it might just be what you need to hear about the causes of these neuralgias. Now, first of all, we should talk about what a neuralgia is. And neuralgia is basically just a fancy word for nerve pain. Okay, so if you've been diagnosed with occipital neuralgia, trigeminal neuralgia, pudendal neuralgia is a bit further south, or nerve pain in the leg, neuralgia is just a fancy word for nerve pain. So today we're talking about what the causes of nerve pain are, and there are four main causes of nerve pain that we see here at the clinic. The first one is a compression of the nerve. Okay, so a compression of the nerve can cause issues wherever the nerve is compressed. And it can be compressed by a disc, it can be compressed by perhaps bony change in your spine, or it could be compressed by something muscular or vascular where the nerve actually passes near the muscle or the blood vessel. This is really common in some, if you like, presentations of trigeminal neuralgia. So often you have the artery and the nerve passing next to each other, and there's a small operation that's done to give it a little bit more space to let the nerve breathe. It doesn't always work, but it does work at times when that nerve and that blood vessel get a bit close to each other. You also may have seen some surgeries happen with the neck or the back where there's some compression happening from a disc, or perhaps some bony changes in the spine that's compressing that nerve and causing the symptoms, causing the pins and needles and numbness, causing the pain. Obviously, the way that you diagnose that is with a scan, and you need to match the scan result up with the symptoms that you currently have. So you can have compression on the spine or compression on the nerves coming out of the spine or anywhere else for that matter, but if you've got no symptoms, it's really nothing to worry about. It needs to be matched up symptomatically and also diagnostically with nerve blocks at times as well to see if that is the cause of the issue. The second thing is irritation of the nerve. Okay, so what irritation of the nerve is a inflammation in or around where the nerve is. So it can be where the nerve comes from, or it can be just around the nerve itself due to some sort of accident, some kind of impact to the nerve that is there. So if there's one under your skin, you might get a dead sort of patch on your skin, or it may well be feeling like a stinger or something if you've whacked your elbow and you've got a bruise around your funny bone. That's your ulnar nerve that can be causing some issues there, and if it's got some inflammation around it, that can cause nerve type pains as well. So inflammation and irritation is the second one. The third type of nerve pain, or the third cause of nerve pain, is what we call mechanosensitivity, okay? Or in layman's terms, sensitivity to movement. Now, it's a little known fact by some people that nerves actually move like a hose across the grass in the garden. So it's like the hose moves like that. So when you have what we call mechanosensitivity, the nerves are moving nicely through the leg or through the arm or through the back. But what's happening is that your brain is perceiving that nerve movement as a bit dangerous. Okay, so even though it's a normal movement, your brain is perceiving it as being a bit of an issue. So this is common in people that can, if they bend forward with their toe pointed, they might get a bit of a stinger down their leg. Or, for example, if they've got their hand in a certain position after a whiplash injury, that they start getting tingling down into their hand or down their arm. Sometimes it can masquerade as carpal tunnel. So when you've got this mechanosensitivity happening, what we need to do is normalize the movement of that nerve and teach your brain that moving that nerve is safe. And there's a whole bunch of exercises that can be done in order to make sure that your nerve pain can wind down if that mechanosensitivity is the issue. The fourth and final one is referred pain. Okay, so quite often what can happen is that you're diagnosed with a neuralgia. Okay, so that there's pain in or coming from the nerve that is affected. So for example, a trigeminal neuralgia or occipital neuralgia. Now the symptoms mimic issues with the nerve, but what can happen sometimes is the brain can get tricked. So there's actually nothing physically wrong with the nerve at all. There's no compression, there's no irritation, and there's no mechanosensitivity really, but your brain is interpreting the signals coming from somewhere else and shooting it to that nerve. So this can often happen when you've got sciatica type symptoms as well, where the issues are more coming from, say, a trigger point in your glute muscle, or in your face when it's a trigeminal neuralgia, when it's referring from a joint in your neck instead. So what you need to make sure of when you've got nerve pains or neuralgias is that you're looking at those four categories: the compression, the irritation, the mechanosensitivity, and the possibility that it could be a referred pain. If you look at those four things and you look and diagnose it systematically, and certainly if you go to somebody experienced, they're able to determine relatively quickly which one it is based on your history, your symptoms, the behaviour of how the nerve pain works. And then you can get a plan in place to actually start winding it down. It doesn't always need to be surgical, it doesn't always need to be injections. You can do this sort of thing with really good conservative physiotherapy as well, with movement, with strength, with desensitising your system down naturally, drug-free, so that you're able to actually get back to doing what you want to do and make nerve pains and neuralgias a thing of the past. Hope that's been really useful. You can type in the comments below if you've got a question. Certainly, if you do suffer from any of these nerve pains or neuralgias, it is worth getting checked out to see if there is something that can be done for you. That's the end of the video. I hope to see you again soon. Cheers and bye for now.